Magandang umaga sa inyo lahat. Ngayon pag-usapan muna natin ang isa sa rin sa mga high yield na concept sa ating respiratory system. That is what you call your pneumonia. Pneumonia, guys, in general term, nangyayari yan as a consequence of inflammation, okay, in the lung caused by microorganisms or irritants. Okay, bakit sinalin natin yung irritants dito? Kasi yung irritants usually nagko-cause din yan ng pneumonia. One common example of it is when the pneumonia is caused by inhalation of water, inhalation of oil, inhalation of food, and that is what you call your aspiration pneumonia. Okay? So pag-usapan natin yan mamaya yung different types of pneumonia natin. First is pneumonia. Okay? Pneumonia. General overview muna tayo as stipulated in your book, because in your book it's general overview, then pathophysiology, then you have your signs and symptoms, assessment and diagnostic findings. Then you have then the medical and tsaka nursing ng mga responsibilities. Okay, so yun din yung progression ng topics natin dito sa YouTube channel na to. Just to have an organization of the presentation of the topics natin. Okay, so that's how I took my notes down when I was just a student, and that's how I'm going to teach certain topics, the way I teach certain topics. Again, pneumonia is an inflammation of the lungs caused by microorganisms or irritants, and it can be caused by bacteria, mycobacteria, or viruses, or even foreign agents. Okay, yung sinabi natin kanina. And next is that pneumonia actually, if you have or if you develop pneumonia, okay, if you develop pneumonia, it predisposes you to microbial invasion. Why is that? Why is that? Anong ibig sabihin ng salitang it predisposes? What do you mean? Okay, what do you mean by the word predispose? Okay, predisposes means that nilalantad ka niyan. Okay, to some extent ini-increase niya yung risk mo. Okay, increase niya yung risk mo to microbial invasion. Bakit nangyayari yan sa pneumonia? Because in pneumonia, we have what you call your mucus pooling. Okay? Yung sinabi natin, yung diniscuss natin as the same phenomenon that is discussed in chronic bronchitis, in chronic obstructive pulmonary disease. There is also mucus pooling there. Specifically, the mucus causes blockade in the and causes narrowing of the airways, okay, of our patients. So in this patient, in this case, it has mucus pooling. Anong nangyari? Because there is an increase in the amount of mucus that is secreted, the mucus tends to dislodge and pool. What do you mean? It stays, okay? Nananatili yan sa baga natin, yung mucus na sinisikret ng ating katawan as a consequence of pneumonia. Now, pag hindi yan nakuha o hindi yan dislodge o hindi yan nilabas ng ating katawan, that becomes a harbor. What do you mean by a harbor? Nagiging bahay, nagiging attractive yan sa ating mga microbial agents, mga germs. Okay, kagaya ng viruses, kagaya ng bacteria, kagaya ng fungi. And that can increase the chances of your infection. Okay, so that's why, according to your Bruners and Sudars, pneumonia predisposes your patients to microbial invasion. Anong mga classifications ba ng pneumonia natin? Okay, there are different types of pneumonia, by the way. First, we have community-acquired pneumonia. Next is hospital-acquired pneumonia, as stipulated in your Bruners and Sodars. Ano pa? Pneumonia in the immunocompromised host. These are the pneumonia specifically stated. Actually, there are a host of different types of pneumonia. Okay, but in your book there are only 4 subclassifications. And lastly is aspiration pneumonia, and we're going to discuss that one by one in this YouTube video. Okay, so first we have community-acquired pneumonia. Ano nga ba tong CAP or community-acquired pneumonia? Ang community-acquired pneumonia natin is when, okay, specifically stated in your book, when pneumonia or the infection occurs within 48 hours, okay, underline, highlight, and remember, 48, okay, within or less than 48 hours. Bakit? Anong ibig sabihin na nag-develop siya ng pneumonia after or within 48 hours of hospitalization? Okay, take note this one, okay, of hospitalization. Ganito nyo yan i-visualize. Okay, imagine you have a patient na admit ngayong araw. Tas maya-maya, nagka-pneumonia siya. Okay, nagka-pneumonia yung pasyente mo. Okay, so is it safe to say na nakuha niya yung infection niya dito sa hospital? No, okay? It's not logical to think that way because okay, because pneumonia and viruses and other agents often have this incubation period in order for them to cause actual illness, okay? So it means na malaki ang chance diyan na yung pneumonia na ni-develop sa patient was transmitted or nakuha niya doon sa community, okay? So that's why you have within or less than 48 hours of hospitalization pagka nagka-pneumonia siya in the hospital, you classify that as community-acquired pneumonia. Nakuha ba natin? Yes, very good. Now, the most common agents, okay, causative agents for pneumonia in the hospitalized client is, community-acquired pneumonia, or CAP, community-acquired pneumonia, is S. pneumoniae, H. influenza, yung common flu, Legionella, Pseudomonas aeruginosa, and gram-negative na mga rods natin. Okay, the most common here is Pseudomonas. Okay, Streptococcus pseudomonas is the most common cause in younger adults without any comorbidity. Ito yung importante. Sa mga causative agents, hindi nyo kailangan i-memorize kung anong lahat-lahat ng causative agents ng pneumonia. All you have to do is ano ang most prevalent among age groups. First is S. pneumoniae. Saan siya common nangyayari? In older adults, older individuals with comorbidity. Ano ang ibig sabihin ng comorbidity? I know this is a common term. I know you've been hearing this in the news when we had the pandemic. Anong ibig sabihin ng comorbidity? So anong ibig sabihin ng comorbidity? I know you've been hearing this a lot. What do you mean by the word comorbidity? Okay? This comorbidity, what do you mean? Comorbidity means that the patient's present medical condition or may mga sakit na ba siya. Kung may mga sakit na, okay? Kung may mga sakit na sila na iniinda kagaya ng diabetes, kagaya ng hypertension, those are called comorbidities, the present cases, okay? S. pneumoniae daw is the most common cause of community-acquired pneumonia in patients without comorbidity and in older patients with comorbidity. So yung mga healthy adults natin, ang common cause ng pneumonia dyan are S. pneumoniae. And those older adults, yung mga older adults natin, when we talk about geriatrics, okay? Geriatric nursing, yung mga older adults natin, they have this dampened immune response as a consequence of physiologic processes as a consequence of older age, diba? So the immune system is weaker, the immune system has decreased capacity to fend off against infection, and so as a consequence you get more infection. And so when an older adult has difficulty fending off against S. pneumonia, then the patient usually has pneumonia, develops pneumonia more easily. Ano pa? You have your influenza, okay? Influenza, which usually affects individuals in the elderly groups. Bakit elderly? Again, because they have dampened immune systems. Okay, they have dampened immune systems as a consequence of normal process of aging. Now, usually, bakit siya nakaka-apekto sa elderly and hindi sa mga normal individuals? Because normal individuals usually don't develop pneumonia when they encounter H. influenza. Usually, common colds lang yan. Okay? Okay, yan yung tandaan natin. Ano pa? Viruses are the most common causes of pneumonia in infants and children, but less common in adults because in adults, yung immune system natin nagmamature na. Whereas compared to those infants and children, their immune system are still on the process of maturing. Yan yung nangyayari. And lastly is that cytomegalovirus is the most common viral pneumonia in immunocompromised host. Yung mga patients natin na may acquired immunodeficiency, immunosuppression dahil sa gamot, yung mga ganyan, ang common causes niyan are cytomegalovirus. All you have to do is familiarize the most common na mga causative agents. You don't have to memorize. Familiarize lang yan, guys. Familiarize lang yan, okay? Panoorin ang video, tsaka i-integrate. Just i-apply mo sa question and answer, okay? I-apply mo agad sa question and answer. Huwag mong intayin na parang balot na 18 days na hindi mo nire-review, di ba? Wag ganyan. Ngayon, nagre-review ka pagkabukas review ka na naman. And then, i-review mo naman after 3 days. After 1 week, i-review mo na naman. That is your incremental, okay? Incremental reviews, okay? That's the process of incremental review. So, ganyan yung gawin mo. Next, proceed muna tayo. Next is what we call your hospital-acquired pneumonia. Kung tinatawag nating hospital-acquired pneumonia usually happens daw, according specifically in your book, within 48 hours after admission. After admission, more than 48 hours after admission, because now you can say na may possibility na ang nakuhang pneumonia ng patient ay galing sa hospital. Okay? Now you can say that na nakuha ng patient mo na pneumonia ay galing sa hospital. That's when you can say when the patient is already in the hospital for more than 48 hours. Nagets niyo? Very good. Okay. Ano pa? Ventilator-associated pneumonia, guys, is the most common. Okay? Is common related to mechanical ventilation. Bakit, guys? Bakit? Okay, bakit kaya? Bakit kaya ventilator-associated pneumonia is the common or most common hospital-acquired pneumonia? Because ventilators or mechanical ventilation or yung mga tubings natin, they require external opening. Okay, external opening via puncture or via intubation, or pinapasok mo yung tube sa katawan ng pasyente mo. And that is an external opening which is exposed to the outside environment of the hospital. And the hospital has, to some extent, imagine niyo, may na mga microbes dyan na nag-float lang. May mga microbes na airborne, may mga microbes na droplets, at saka pag hindi sakto yung precautions ng hospital, madali lang talaga na dapuan ng mga germs yung opening ng ventilator sa katawan ng pasyente natin. Okay? So yan yung tandaan nyo. Yan yung reason why hospital-acquired pneumonia, the most common cause of hospital-acquired pneumonia is a puncture due to intubation or mechanical ventilation, because pinapasok yan sa loob ng katawan ng pasyente. Okay? Next is that mechanical ventilation usually ventilator-associated pneumonia usually happens about more than 48 to 72 hours after intubation. Again, by the same virtue, or by the same reason, okay? By the same reason, okay? Because it causes an external opening from the body, from the patient's body, in the patient's body, okay? Nakuha natin? Okay, very good. So ano pa? Hospital-acquired pneumonia is associated with high mortality due to the virulent and antibiotic-resistant organisms, okay? Ito yung tandaan natin, guys. Ang mga nagko-cause ng pneumonia sa hospital-acquired pneumonia, ang nagko-cause, ang mga agents natin dito are virulent. What do you mean by the word virulent? Kung sa isipin pa natin to, ang ibig sabihin ng virulent is yung mga agents or yung mga viruses na grabe ka-aggressive na mag-cause ng sakit. Yan yung virulence niya, guys. Okay? The high probability that this agent or this virus or this bacteria causes a disorder that's viral, the virulence of a particular, okay, agent. Now, in hospital-acquired pneumonia, tandaan nyo, virulent ang agent, usually yung agents natin in hospital-acquired pneumonia are virulent and antibiotic resistant. Bakit? In the hospital, usually may mga pasyente ka kasi na nag-a-antibiotic. Tsaka there are common cases where when you have a patient that is taking antibiotics, especially when you have monotherapy. What do you mean by monotherapy? When you have only one, okay, antibiotic per patient, one type of antibiotic, malaking chances yan na mag-develop ng resistance yung agent natin, kagaya ng tuberculosis, okay? So, ang ginagawa ng doktor or ng nurse ng therapist ay polytherapy siya, okay? Polytherapy. Anong ibig sabihin yan? Dinadamihan yan ng mga iba't ibang klase ng antibiotics para hindi madaling maging resistant ang organism sa ating mga antibiotics, guys. Okay? The most common pathogens causing hospital-acquired pneumonia are the Enterobacter, E. coli, influenza, MRSA, and S. pneumonia pa rin. Okay? take note, MRSA, methicillin-resistant Staphylococcus aureus. Okay, this is a very, very virulent, okay, a very, very virulent microorganism that is resistant to methicillin, which is, sabihin na lang natin na isa sa mga most effective na antibiotic sa ating arsenal. So maraming natatakot na mga healthcare providers dito. Because when you say that the patient has MRSA, malaking possibility yan na maraming mga antibiotic na hindi na gumagana sa pasyente na yan. Okay? That's why delikado siya. Bakit? Kasi mahirap siyang hanapan ng appropriate antibiotic. Because because you're a doctor who's going to give an antibiotic to the patient, all you hindi lang yung antibiotic ang the effectiveness of antibiotic ang kailangan mong i-gauge. Kailangan mo ding i-gauge kung kaya bang i-tolerate ng pasyente ko ang antibiotic na to. Kaya ba niyang i-excrete sa labas ng katawan niya? Kaya ba niyang iihi? Wala bang side effects? Yung ganyan. Okay? Now, if you're going to give a much more stronger or mas malakas na antibiotic, mag-i-expect ka na mas maraming side effect na mangyayari sa pasyente mo. Yan. So as much as possible, we're trying to give, okay, ang principle niyan is ALARA, as less as reasonably as possible. But to some extent, marami na ngayon ang antibiotic resistant na mga agents natin. Yan yung nakakatakot no? Hindi mo alam kung anong nakadapo sa iyo. Antibiotic resistant na pala na agent, okay? So take note, okay? Listen to your doctor. Have prescriptions before you take in the antibiotic. Okay, it is usually seen in debilitated patients with prolonged intubation. Again, or tracheostomy. Yan yung highlight natin. Prolonged intubation. Usually nangyayari to in prolonged intubation or tracheostomy. Again, because there is an external opening, guys. There is an external opening. Yan yung highlight ng book natin sa Brunner's and Sodar's. Huwag niyong kalimutan yan, okay? Huwag niyong kalimutan yan. Now, anong mangyayari sa x-ray natin kapag nagkaroon tayo ng pneumonia? Hospital-acquired, in general pneumonia. Magkakaroon tayo ng tinatawag na pulmonary infiltrates na makikita natin sa x-ray natin. Anong ibig sabihin ng pulmonary infiltrates? Ibig sabihin yan, guys, or pulmonary infiltrates. These are accumulation of dense areas that are usually denser than air. So they present in the x-ray with this whitish, okay? White or hazy, or what you call hazy or grayish na areas in the x-ray. That's what you call pulmonary infiltrates, and they are a significant finding in your hospital or in your pneumonia in general, okay? They are significant finding in your pneumonia. These are white areas in the x-ray, okay? Proceeding, okay. Next is pneumonia in immunocompromised host. When you talk about immunosuppression, ito yung mga taong may karamdaman that are associated with a weakened immune system, kagaya ng AIDS, kagaya ng mga taong nagtitake ng certain medications, kagaya ng steroids. Steroids can cause certain immunosuppression to an extent. So, pwedeng mangyari ang pneumonia in immunocompromised host in these patients who are taking these types of medication. So, first is pneumonia in immunocompromised host. The most common is PCP. What do you mean by PCP? PCP, guys, means pneumocystis pneumonia. Okay? Pneumocystis. Discuss natin yan mamaya. Okay? Pneumocystis pneumonia, fungal pneumonia, and tuberculosis. Now, take note that pneumonia doesn't really usually come from fungal infections. Okay, yan yung totoo. Because when you have a fungal infection, the body usually eliminates that easily. Okay, kasi ang body, it's built up. Okay, it's built up against this defense against weaker microbes, kagaya ng fungus nyo. Now, kapag may immunosuppression ka, kahit fungus pa yan, kahit mga microbes pa yan, na usually nakikita natin sa ating katawan, they can cause pneumonia and other types of disease, because again, you have a dampened immune system. Okay, so PCP is known as pneumocystis jirovecii. Okay, tingnan muna natin kung anong saktong pag-pronounce nito. I'm sorry, it's pronounced pala as Gerovesi. Okay? Gerovesi. It usually is associated, this pneumonia is associated with corticosteroid. It's again, pneumonia in immunocompromised hosts is usually associated with corticosteroid use or chemotherapy, malnutrition, and usually other types of certain diseases. Anong common dito? Anong common sa kanila? Anong common sa mga conditions na to? They cause immunosuppression. Okay, all of these conditions cause immunosuppression. Corticosteroid use has a side effect called immunosuppression. Chemotherapy causes a marked tawag natin dyan, pancytopenia, and as a consequence, decreases the amount of white blood cells circulating. Ano pa? It dampens the hematopoietic system that makes a lot of our white blood cells, so it causes immune suppression in general. Okay, ano pa? Kung ang ating hospital-acquired pneumonia ay high virulence, yung mga disease-causing organisms nila, di ba? Yung sa notes niyo kanina sa previous slide, nakita natin na ang cause niya is virulent. Yung mga kadalasan talagang grabe ka-aggressive na mga microorganisms yung nakakokos ng disease niya. Pero dito sa pneumonia natin in an immunocompromised host, usually yung mga virulence natin ay galing yung sakit natin, yung agent natin galing sa low virulent organisms. Anong ibig sabihin ng low virulent? Usually hindi nakakokos ng sakit sa mga normal na individuals. Okay, that's what you mean by low virulence. Kung sa normal individual nilagay mo yung E. coli, hindi siya magkukos ng sakit kasi kayang patayin ng immune system mo yung E. coli madali. Okay? So ano pang mga low virulence organisms na common sa immunocompromised hosts? You have your Pseudomonas. Yes, very good. Pseudomonas. In all of these in all of these types of pneumonia, all you have to remember is that the clinical presentation of pneumonia is similar. Okay? The clinical presentation, yung progression ng disease niya, is similar regardless of the immune status. Okay? Even if the patient has immune suppression or wala, yung progression ng sakit ng pneumonia is similar. Usually, you get a fever, you have infection, you have chest pain, pleuritic chest pain, at we'll talk about that later in the signs and symptoms section of this discussion. Okay, next, another type of pneumonia is aspiration pneumonia. When you talk about aspiration pneumonia, it results from, okay, galing yan sa mga substances that enters the airway. Substances, hindi siya agents, okay? Hindi siya microbial agents, viruses, or bacteria. It comes from substances na hindi dapat pumupunta sa lower airway mo. Kagaya ng tubig, kagaya ng oil, kagaya ng food. Those can cause aspiration pneumonia, okay? Aspiration pneumonia, as specifically stated in your Brunner's and Stoddard's, can occur both in the community as well as in the hospital setting. Okay? Kailangan yung tandaan yan. Okay. Next is that an example of situations wherein aspiration pneumonia occurs in both the community as well as in the hospital. Like for example, if you have contaminated oral or gastric secretions during intubation. Okay, ganyan, na-aspirate ka, okay? So, another example is when you accidentally aspirated on a food. That can cause aspiration pneumonia in itself, okay? So, it can happen in both the community and the hospital setting. Ano pa? Okay, these are examples. Ano pa guys? Aspiration impairs the lung defenses, which causes inflammation and promotes bacterial growth. Anong ibig sabihin yan? When you have, like for example, a water that gets into your lungs, okay? Water gets into your lungs. What happens is that the water impairs the ability of the white blood cells to function, okay? Or in some sense, meron kasing mga structures dyan in your lungs that are called what you call your cilia, okay? Your cilia. Ang cells natin sa lungs, may mga hairs yan sila, okay? Those that are exposed in the outer surfaces of their lungs, may hairs yan sila. And the purpose of the hairs is to have this movement, a wavy movement that dinadala nila yung foreign agents natin. Dinadala nila pataas, pabalik sa external surface. Okay, like for example, dinadala niyan at saka nagsisikret niyan sila ng mucus para to some extent i-brush off yung mga external agents natin. So anong nangyayari kapag may substances that there are substances that impede their function, like for example during aspiration of water, the ability of the cells, these hair cells, to function is impaired. So meaning hindi na nila nagagawa yung function nila, and therefore hindi na nila nare-remove yung mga foreign matter, yung mga dust na dapat i-remove sa lungs. So yan yung nangyayari. Ano pa? Okay, pathophysiology in general of our pneumonia is first is there is an inhalation of pathogenic organisms. Usually it takes in the form of irritants from smoke or pollutants. Okay, when you have this, the microbes reach the alveoli. Okay, the microbes or the irritating agent reaches the alveoli, and then it causes an inflammatory response. Okay, it initiates an inflammatory response, and there are two consequences of this. Number one is there is an increase in vascular permeability. Okay, mas madaling mag-form ng fluid. Okay, lalabas yung fluid papunta sa lungs natin. Okay, thus increase in vascular permeability. Ano pa? Anong pang mangyayari? There is, okay, as a consequence of increased vascular permeability, yung lalabas yung fluid papunta sa lungs, magkakaroon tayo ng localized edema. Okay, localized edema as a consequence of your inflammatory response. Ano pa? There is increase in the amount of neutrophils and macrophages in order to fight off or fend off the infection or the impending agent. Yan yung normal progression ng disease processes natin, especially during pneumonia or during certain types of infection. May tawag dyan, recruitment of neutrophilic cells as well as macrophages. Mag-i-increase in number yan sila. And when this happens, the microbes are engulfed. Okay? This is the purpose of this one is to engulf and to destroy the microbes. But as a consequence of the engulfment of the microbes, you have alveolar consolidation and exudate formation. Anong nangyayari? Magkakanana yan. Okay, magkakanana. Magpo-form siya ng pus or deposition of exudate. Exudate is to some extent your exudate. To some extent, guys, your exudate is a combination or a combination of different types of substances. It is actually a combination of different types of substances. More specifically, a combination of cells, protein, and engulf or digested materials that is in your lungs or in the passageway of your lungs. So as a consequence of edema as well as exudate formation, you then have occlusion. Okay? Occlusion. Anong ibig sabihin ng occlusion? Pagkabara ng alveoli at ng bronchi natin. Kung may bara ba ang bronchi at alveoli natin, makaka-breathe ba ng tama ang isang tao? Hindi. Okay? You have then what you call hypoxia. Okay? The decreased amount of oxygen delivered in certain tissues or localized tissues. Okay? Magkaiba yan sa hypoxemia, which is the hypoxemia is specifically pointing out to the amount of oxygen that is in the bloodstream. Okay? So when this happens, when you have alveolar, look at this one, okay? When you have alveolar consolidation and exudate formation, you then have a release of pro-inflammatory cytokines. Ito yung nangyayari usually sa COVID natin. When you research about COVID, there's tawag dyan, cytokine storm. Okay? But in this case, ang kailangan lang nating maintindihan is that pro-inflammatory cytokines causes further immune response. So ang nangyayari dito, ito, pabalik, nagiging feedback loop yan. Nagiging feedback loop. So, ang nangyayari, mas dadami yung exudate sa katawan natin. Magkakaroon tayo ng mas malaking problema. Bakit mag-accumulate yung fluid in certain areas of our body as stipulated as the presence of edema. And as a consequence of this negative this feedback loop, you have ventilation perfusion mismatch. Kung hindi nyo napanood yung video natin sa ating chronic bronchitis, ventilation perfusion. Ventilation is the amount of air that gets into the alveoli, while perfusion is the amount of air that gets into the arteries. So usually equal yan sila, guys. There is an equal ratio and proportion of ventilation and perfusion. But when you have kapag nag-i-inhale ka and there is occlusion and occlusion in the alveoli, even if nag-i-inhale ka ng air, hindi yan aabot sa arteries mo. Hindi yan aabot sa ugat, and therefore hindi aabot yan sa systemic circulation. And therefore, you get what you call your hypoxemia as a consequence. A systemic decrease in oxygen or the amount of oxygen in the body. Okay? Very good. So, anong risk factors? Pag-usapan naman natin yung risk factors ng pneumonia natin. First is travel. This is specifically stipulated in your Brunner's and Sodar's. Travel, exposure, and residence in long-term care facilities. Bakit, guys? Bakit? Anong common sa kanila? There is close proximity to other people. Okay? When you have close proximity, there are increased chances. Okay? There are increased chances of transmission of different types of pathogen. Kagaya ng mga, depending on what type of pathogen are we talking about. Like for example, flu, yung ganyan, strep, yung ganyan. They are commonly, okay, makikita natin dan sa travel, exposure, and residence in long care facility. Anong ibig sabihin ng exposure? Usually, yung mga tao nagtatrabaho sa mga high risk na mga environments like hospitals, like laboratories, yun. Pwedeng risk factors din yun. Okay? So, ang common sa kanilang lahat, ito, is that they are in close proximity with agents that cause pneumonia. Okay? And, ano pa, if you have compromised immune defense, okay, like AIDS, like again, when you're taking in drugs that halt and dampen the immune response, then that can cause your pneumonia. Ano pa, heart failure, diabetes, and COPD also increases pneumonia. Bakit? Bakit, guys? Bakit heart failure, COPD, and diabetes can increase pneumonia? Because in heart failure can lead to, okay, can lead to accumulation in the fluid of accumulation of fluid in the lungs. Okay, when you have this can happen in both left and right-sided heart failure, but more commonly in left-sided heart failure, you have accumulation or what you call pleural edema. Okay, you have pulmonary edema in left-sided heart failure. So fluid accumulates in the lungs, and therefore it can increase the risk of pneumonia. Because again, fluid accumulation, when you have pools of fluid in the lungs, it can be used or it can be treated as a haven for microbes. Okay, they can use that as environment to grow and flourish. Ano pa? Diabetes. When you have diabetes, you have high blood sugar levels. And ang sugar natin, guys, isa yan sa pinaka paboritong pagkain ng ating mga bacteria. And therefore, you have increased susceptibility to infection. Okay? Increased susceptibility to infection. Ano pa? When you have COPD, okay? In COPD, you have weakened respiratory defenses. Bakit? Because ang dami-daming mucus, hindi maka-move ng maayos yung mga macrophages natin, at saka hindi rin maka-function yung mga ciliary cells natin, yung may mga parang tentacles at mga hairs kanina yung diniscuss natin. Those are part of your respiratory defense. Okay? This is because again of the presence of smoking, as smoking impedes the function of the respiratory defenses. Okay? Ano pa? Cystic fibrosis. Okay? Cystic fibrosis is also associated with your pneumonia. Bakit? When you have cystic fibrosis, guys, ang ano mo, yung secretions mo is very viscous. Anong ibig sabihin ng viscous? There is increased viscosity of secretion, specifically your mucus. Bakit? Sa genetic composition yan ng cystic fibrosis, and in another video we'll discuss about this curious disease. Okay, anong ibig sabihin ng viscosity? Malapot, napakalapot ng secretions natin. Okay, yung plema natin napakalapot, so mahihirapan kang mag-expel ng plema. So mas maraming time na mas maraming chances na mag-accumulate siya sa lungs natin, and therefore again, kapag kagaya ng COPD, mas lessen ang ability to expel those foreign matter. When you have malapot na plema, ang mangyayari dyan is mahirap siyang i-expel out of the body, and therefore yung plema, nagsistay siya sa respiratory system natin, and that can be used again as a haven for microbes, as a tirahan ng mga microbes natin, yung mga germs natin. So, next is aspiration pneumonia. Anong ibig sabihin ng aspiration pneumonia? Aspiration pneumonia is results from the entry of substances into the lower airways. Okay? Aspiration pneumonia, like for entry of substances. Note the term substances. Anong ibig sabihin ng entry of substances? I go as far as to say, ito kasi, galing to sa Brunner's and Soder's nyo. Substances that cause aspiration pneumonia are substances na hindi mo usually nakikita sa respiratory passages mo or respiratory system. Ano bang usually nakikita mo sa respiratory passages mo? Air at saka your mucus. Yan yun talaga yung dalawa. So anything that is gets accumulated in there that is not usually seen is a foreign agent, and therefore that's included as that can be interpreted as a foreign agent. Like for example, water, food, ano pa? Water, food, oils. Yes, there is oil tawag dyan, may term dyan. Okay. So, oil and water, common na mga nagkukos ng aspiration pneumonia, especially in near drowning. And i-discuss natin yan kung may panahon tayo, magre-record ng emergency nursing. Okay. Aspiration pneumonia. Now, pag-usapan naman natin ang clinical manifestations ng ating pneumonia. Ano bang common presentation ito? First of all, I want to say that according to your book, it varies based on pneumonia type. Depending on pneumonia, like hospital-acquired, community-acquired, immunosuppressed na pneumonia caused by immunosuppression, or pneumonia, aspiration pneumonia, nag-vary yung presentation or signs and symptoms niya. Okay? Or nag-vary yung signs and symptoms depending on the type of pneumonia nakikita mo. But in general, anong nakikita mo dito? You have increased in respiration. There is what you call tachypnea, respiratory distress, rapid and bounding pulse. Why do you have rapid and bounding pulse? This is actually a compensatory mechanism of the body. Okay? A compensatory. When the body detects that you have low oxygen levels, ang ginagawa ng body is to increase heart rate. Okay? Now, if you have pneumonia, ang nangyayari dyan is there is, kagaya sa COPD, to some extent, there is pulmonary vasoconstriction. Okay? So, there is bounding because there is high pressure, and rapid because you have tachycardia. Okay? That's why you have rapid and bounding pulse. Now, may tinatawag din tayong, there is also a presence in relative, what you call relative bradycardia. Okay? This is specifically seen in viral or atypical pneumonia. Okay? When you talk about relative bradycardia, are you familiar with that term? Relative bradycardia. Okay. Anong ibig sabihin ng relative bradycardia? This is a very, very in-depth concept, pero nakita natin to or mababasa natin to sa Brunner's and Soder's natin. Okay? In your relative bradycardia, usually kasi, okay, tinatawag din natin yang pulse and temperature dissociation. Okay? Tinatawag din natin yung pulse temperature dissociation. Usually kasi guys, when you have an elevated body temperature, the body responds by increasing the heart rate. Okay? So meaning, increase in temp, there is usually also a normally increased heart rate. Okay? Kagaya ng mga pasyente natin na may fever, usually makikita din natin na abnormally elevated din yung HR nila. Okay, that's the pulse and temperature coupling. Now, in viral infections, ang makikita nyo is that heart rate is lower than the expected given their body temperature. Meaning, even if may fever na yung pasyente, yung heart rate natin hindi tumataas. Okay? Relative to your temperature. Kaya tinatawag siyang relative bradycardia. Nagets nyo? Okay, hindi siya to some extent bradycardia by common definition, but it's relative to the temperature in the body. Okay? Very good. Okay, next is there is usually in pneumonia poor appetite, diaphoresis, or anong ibig sabihin ng diaphoresis? Yung pagpapawis. Very good. Diaphoresis, pagpapawis. And there is, importantly, the presence of pleuritic chest pain. Yung pananakit ng dibdib, or yung parte ng ating baga. Okay? So ano pa? Anong assessment and diagnostic findings na kailangan nating tandaan when we talk about exams associated with pneumonia? First is we ask history. Ask about recent respiratory tract infections. Okay? May sintomas ka ba ng sipon? May ubo? Those are parts of your history. Ano pa? Physical examination. In physical examination, dito mo nakikita kung may fever, may cough, may shortness of breath ang patient mo at saka chest pain. Kagaya ng mga clinical presentations ng pasyente natin. Ano pa? When you look at the x-ray of patients with pneumonia, you have infiltrates. Yung sinabi natin kanina, which are white spots. Okay, white spots in the lungs. Okay? Areas of opacity or gray-white spots. Ano pa? Blood culture, which is one of the most important things na kailangan responsibility ng nurse. Not necessarily responsibility kasi sa medtech to, but it pays to know that blood culture is used routinely in pneumonia to determine what kind of agent is doing the disease or causing the disorder. Okay? So this indicates that the bacteria, when you do blood culture, according to Brunes and Sordat, this also indicates that it might also indicate that the bacteria spread to the bloodstream. Okay, so maybe there is a risk of what you call sepsis or systemic localized systemic infection. Okay, anong prevention natin dito sa pneumonia? Okay, important prevention. Get vaccinated against pneumonia. And ang important vaccine na kailangan nating tandaan is pneumococcal vaccine. Okay, pneumococcal vaccine is usually given, recommended in 5 years of age. But pwede itong ibigay sa infants natin in 4 doses. Okay? In 4 doses. Pero, sa board exam, kailangan lang to some extent, yung board exam mo, ang important na kailangan nyo lang tandaan is what is the route at saka yung dose. How many doses are there in pneumococcal vaccine among age group? So, infants, you have 4 doses. Adults, you have 1 to 2 doses. Depending, there is a booster dose, and there is 65 years old and older. There is only 1 dose, usually intramuscular in deltoid. Okay, so ano pa? We need to wash our hands. Okay, because that walang kamatayang hand washing yan. Okay, washing your hands can prevent a host of disorders or diseases. Okay, ano pa? Avoid close contact. Kagaya ng sinabi natin kanina, risk factor is traveling. So avoid close contact and do not smoke because smoking impairs the respiratory bacterial defenses. Okay? So ano pa? Medical management ng pneumonia natin is antibiotic therapy. And antibiotic therapy is guided by your culture and sensitivity, your gram staining. Okay? Hindi dapat magbigay ng antibiotic specifically to pneumonias when you don't know the impending agent. Pero in some cases, nagbibigay tayo ng broad spectrum. Anong ibig sabihin ng broad spectrum? Maraming in broad spectrum yung maraming scope ng mga agents ang napapatay niya. Like for example, a host of gram-negative bacteria, a host of gram-positive bacteria. That's what you call broad-spectrum antibiotics. Okay? Consider the pattern, the risk factors, and the treatment setting. Bakit? Okay? You need to look at the resistance patterns. Okay? When you are a nurse caring for patients in the hospital, okay, you need to realize that in hospitals there is an increased incidence of MRSA. Okay, or methicillin-resistant Staphylococcus aureus. Okay, and you need to look at as well the risk factors. Kailangan mong tandaan kung mag-give ka ng antibiotic therapy, kailangan mong tandaan na maraming side effects yung antibiotic therapy mo. And the treatment setting. Okay, the treatment setting. Ano? Yung sinabi ko kanina, broad-spectrum IV antibiotic for suspected hospital-acquired or nosocomial pneumonia. Okay, hospital-acquired is also known as nosocomial infections or hospital pneumonia. Monotherapy or combination therapy depending on the resistant profile. But usually, combination therapy yung ginagamit natin. Okay? Okay. So, wala to. I'm sorry. Wala to. Okay. Monitor and survey the susceptibility patterns for pathogen. Okay. Kung ikaw nurse, kikare ka ng mga pasyente mo sa ward, all you need to realize that you need to look at, okay, you look at the susceptibility patterns of your patients. For example, if you're caring for patients with immunosuppression, yung mga nagtitake ng corticosteroids specifically, okay? So kailangan mong tandaan na more susceptible sila in developing hospital-acquired pneumonia. So anong gagawin mo? You secure preventive measures against the transmission of agents, okay? So in future videos, we'll talk about the mode of transmission of certain agents, as well as how do we break the modes of transmission. Okay? So, anong complications ng pneumonia natin kapag hindi natin to naagapan? Okay, what are the common complications according to your Brunner's and Sodar? The most severe complications are the shock, respiratory failure, and cardiac issues. And there is what you call pleural effusion. Anong ibig sabihin ng pleural effusion? Okay, anong ibig sabihin ng pleural effusion, guys? Okay, pleural effusion is usually the build-up of fluid in the layers of the tissue that is lining the lungs. Okay, let's draw the lungs. Okay, this is your lungs. Okay, your lungs is enclosed in the pleural cavity, di ba? Pleural cavity. Hindi yan nakadikit sa sa chest mo. Instead, there is a partition. Meron yang tawag diyan, meron yang spaces diyan. And your space usually is covered with a moist pleural fluid, tawag diyan. Moist high surface tension water. Hindi nyo na kailangan tandaan yan. Pero ang kailangan nyo lang tandaan is that usually may normal amount of fluid dito. Okay? In pleural effusion, ang nangyayari is na nag-increase ang amount ng fluid in these areas. Okay? There is accumulation of fluid in between the lungs and the pleural space. Okay? In between the in the pleural space specifically. Okay? There is build up of fluid in these areas. So, ang nangyayari, hindi ka nakaka-breathe ng tama. Hindi ka nakaka-respire ng maayos. Okay? So, this usually happens in severe stages of the disease. So, anong gagawin natin in pleural effusion? We do thoracentesis to remove the fluid and for relief, specifically for relief, and for the analysis in our laboratory. Kasi ginagamit din natin yan as yung fluid natin as an analysis for culture and sensitivity. So those are, okay, that was our pneumonia topic for this video. Thank you guys, and I hope you learned something.